Um, so people are joining us live stream too on YouTube, and those individuals can't really participate. So if you're joining on the live stream and later you have questions, you won't be able to ask them. But if you responded to the invitation for the Zoom workplace, then you will be able to do that. Amanda, I'm correct on that, correct? Or maybe am I correct on that about the
Yes,
live?
you're right. Only if you're in the Zoom, then you can actually participate or ask questions. Um, you can watch it streamed on YouTube, but you're not able to interact that way.
All right. So it's 12:02. I'll get started. Welcome those that are able to attend live with us. This is the Community Mental Health of Ottawa County, um, CMH Did You Know series. And I've been doing these once or twice a month for the last several months. We missed a month or two, but we cover a wide variety of topics, and it really is did you know? And we've covered the CMH funding streams, we've covered updates from the state's restructuring plan or proposal. We've talked about vital partnerships, and we had our clubhouse, the Lakeshore Clubhouse, on last week. And I thought that I'd kick this series off of the vital partners to illustrate that, you know, CMH of Ottawa County has partners that are part of the system, that are part of us. So, unlike other private practice type of models, CMH, we have vital partners that are, in essence, via contract and other community resources, part of our system. And that's a distinctive for the public mental health system. So, so I have Sarah Lewandowski here, Executive Director of Mosaic County, Mosaic Counseling, President, Executive Director, Co-founder, you know, good clinician, and we're very happy to have a very robust partnership with Mosaic Counseling, both in our millage program that we have, and we are doing tons of referrals for them. And I wanted to give people an opportunity, if you don't know about Mosaic, to have Sarah tell you about it. You're not going to get a 17 slide deck PowerPoint. We're going to have a discussion about it. And then later, Sarah will show you the website and how you can reach them. But for our purposes, they are an instrumental part of community mental health in Ottawa County and other counties. You're in several counties now.
We
And
are,
so,
yes.
yeah. So I thought I'd let Sarah go ahead and tell you about Mosaic, and then later on I'll have some questions and really cement why Mosaic is essential for the mental wellness of Ottawa County. Sarah, take it away.
Well, thank you for that. So I appreciate this very much because you and I have known each other for a long time. And, people still don't know that we are here ready to provide professional counseling. So we were founded back in 1978. So while I like that you called me a co-founder, I really came on the scene actually 21 years ago. So it has been a very long time. But we have a unique model in that we don't hire the therapists, they're not on staff,
Right.
but we contract with amazing therapists who are in private practice that want to give back to their community. So they lower the rates to us. And so that means then when someone reaches out to us for counseling, we are not turning them away and we are seeing them regardless of their insurance status. So they could have amazing insurance. They could have insurance, but no need for a sliding, or not insurance, but no need for a sliding scale. Or they could need a sliding scale because of having a high deductible. But there's insurance plans where someone has 5,000, 10,000 dollar deductible. That's like then you don't have insurance because then that would mean that people have to go find a therapist and pay their rate to bring down that deductible at $150, $200 an hour. It's not happening for most people. And then
Right.
for people who are uninsured, same thing, you're uninsured. Um, our lowest copay is $6. We base it on income plus other things that are going on in your life. So the number of people dependents that you have. I mean, we look at everything and figure that out, what that copay is for you right at our intake session. But really, the most important thing, if you remember one thing about Mosaic counseling, is we do not turn anyone away in Ottawa County. We can get you right in, and we have 270 therapists. So
170.
you're right. So we are here. Sometimes I'll hear people say, "Oh, there's not enough therapists. There's a big wait time." That is not true. In Ottawa County, we have not only CMH but Mosaic to make sure that people have the help they need when they need it.
So let me ask a couple questions and we'll keep going
Please.
because there are some distinctives that you said that are both CMH distinctives and Mosaic distinctives that are aligned.
Hmm.
Turn nobody away regardless of funding source. You
Yeah.
know, and I hate to call you a counseling organization because you're far more than that. Other providers will say, do turn people away. In fact, we
Hmm.
we right now are getting folks that are being turned away. I know you are too, from other resources in the community because they don't have the right insurance or, you know.
Hmm.
And so one of the distinctives that is also a CMH distinctive that you do is no one left behind, no one turned away. And you said $6, not 60, right?
Six.
Six
Six.
and six and for fairness for people watching this later in the recording, I used to be on the panel, so I know
Mhm.
exactly that what Sarah's saying is 100% true. And what's amazing, Sarah, is that you've gone from this many clinicians to over 270 of them.
Right.
And so, and if I'm correct, at Mosaic, you have, I would call it a state-of-the-art matching system of
Yes.
when somebody calls Mosaic and they go through the general intake, it's actually trying to match them with the
Mhm.
clinician that they prefer, with the right
Yep.
expertise.
Yep.
And can you talk a little bit about how that's going and
Oh,
how
yes.
successful that is?
I can. So we do. So for just a little background. So when I started all those years ago, and I used to be a therapist on the panel too, like
Right.
you. But when I started as director, we had 13, 15 therapists. Well, doing the intake was really easy because there weren't that many therapists.
Right.
And then we got more and more, and we had 50 and we had 70. And so we had this matrix that was on paper, and it would have to be updated every other day for insurances. You know, the therapists take all different insurances. And clearly, as the bigger we got, we needed a new plan. So now we have something we call the portal. And the portal is what anyone who's doing an intake here at Mosaic uses. And by the way, we only have 10 staff, so that's
Right.
it. But five of us can do intakes. So when we're talking to someone on the phone about what they are looking for, then we as we're talking, we are looking at the portal and we are clicking on virtual or in person in Holland, where that needs to be, what issues the person is presenting with, what do they need some assistance with, if they want to see a male or female, if faith is important to be a part of the counseling, we can make sure that's happening, that's important to them, and then looking at the insurance, you know, or not. And so all of those things come into play. And sometimes it's personalities as well of our therapists. Someone will say, perhaps, you know what? I just need someone to just listen to me and not offer much. I just need, someone to listen. Or I need homework. I know that about myself, and I need things to do in between. And I need a lot more directive because my other therapist, they didn't say much. So we know those things of nuances about the therapist as well, or their background. So then we make that match, and then the client will call the therapist for their first session. But we always say at the end of that intake, and the intakes can last, it's client dependent. It could
Mhm.
last 15 minutes, or I've done an intake for an hour or more,
Right,
because someone might have been thinking about counseling for a couple of years.
right,
And then that's the first time they're really talking to someone and sharing a story. But at the very end of the intake, we say, listen, we think that this therapist would be a great match for you. However, it's about you.
that's
And
right.
so when you see them, you might not feel that. You might not feel a connection or a rapport with them. And so please reach back out to me, whoever the intake person is, me, not someone
Right.
else, and I can match you with somebody else. I can find someone else for you because we don't want someone to just stop going.
This is amazing because, we have a navigator program here at CMH that tries to do the same thing. But when you were talking, Sarah, I'm going, wouldn't this be? This is kind of like, just imagine if some of the insurance companies spent the
Mhm,
time that you do to match people on their panel. This is
mhm.
individualized. You
Right,
know your panel.
right.
I bet you,
Mhm,
like in the private sector, like they don't know every person. There's
right.
credentialing you go through.
Mhm,
You have to enroll. Do I have the right degree, the license? But
mhm,
you actually get to know
mhm.
all your panelists and you have standards.
Oh,
And
yes.
and
Yes.
that's the thing. Like this is the Mosaic difference. No wrong door. And you're getting people in. I mean, we have a standard at the state that after assessment, if we have to get people within 14 days to be seeing somebody, and sometimes the client says, "No, I'll take an appointment, 16 days or 20 days." But I
Mhm.
think you are getting people in within a 30-day period.
Oh, oh, yeah, absolutely. So I do want to say that um, people can schedule an intake with us. I do want to just add this so I don't forget it by calling, which is great. And that's the way it's always been. But for the last maybe 5 months, we also have an online scheduling. So anybody now can
You just
schedule
go
their own
in.
intake. Yep. Middle of the night, on the weekend, because we're about removing barriers. We want to try and remove every barrier we can. And Michael, we know each other. I have no issue talking. But I have to tell you, sometimes when I am scheduling something for myself, it's more convenient for me to
Yeah,
do that
do it
online.
automated.
So imagine now I'm in crisis or I'm feeling depressed, something's happened. Maybe I really don't want to make that call or I
Yeah,
cannot make it between 9 and 5.
that's right.
So that online has been just really wonderful.
Yeah, and we partner with you as CMH in a variety of ways. One of them is crisis.
Mhm,
Mosaic isn't show up if you're in a like need assessment for hospitalization. You'll still talk to people if they show up. You'll get them to where
mhm.
they need to go, right? And I've seen that
Right.
happen in person, walking in your office one time. But it's not a crisis program per se.
Correct. And you're right. Someone could come in and could be in crisis. But you did ask me about the time to get them in.
Yeah.
Right now, intakes are happening. I mean, the week that someone would call.
Wow.
Sometimes it could be the next day. It just depends on how many. But
That's
if
right.
someone is feeling like, I'm in crisis, not emergency
Right,
CMH
right.
crisis,
They're right in.
but we're going to get them in and we're going to see if do we need to make a referral to
That's right.
CMH? Do we need to make a referral to the emergency room? Maybe it's even not to that degree, but to them it's a crisis. We will do the intake right then. So, I mean, that we're just so flexible that way.
Yeah.
But we do send a survey out to anyone who does an intake. We send a survey out within 2 weeks or 2 weeks after their intake. And it just says, have you made a connection with the therapist referral? Have you either made the appointment or have you seen them? And the last survey results I saw it was 90% of the people who
Wow,
sent back a response said yes, they'd either seen them, have the appointment, and then we want to know why you didn't. Why don't you have an appointment within 2 weeks? And so then it could be, I haven't called yet. Thanks for the reminder. But then maybe I remember once it was they didn't respond to me. They didn't answer my phone call. Well, then we investigate that. Was there a wrong number for some reason? Or did the therapist never call them back? That's a therapist that's not going to be on our panel then. And then you
that's
did
right.
say, we do background check and
You
vet
sure do.
um, all the therapists that are on the panel. Not all of them are invited to be on the panel. And then sometimes, for one reason or another, they could be escorted off the panel. So that's
That's right.
something so important to the community or to anyone who is referring, like you, like CMH, like the courts, like the schools, like churches, that we want you to be able to trust that if they're a therapist on the Mosaic panel, that we have gone through that vetting and that you
And it's
can
open
feel
to,
confident.
are you serving all ages, Sarah?
All ages. Yes.
Wow. And you have a very robust, I don't think people realize how much of a robust presence you have in schools. Can you talk about that a little bit?
Oh, I would love to. So, yeah, 16 years ago, we discovered that we were missing a lot of kids, that they were coming in crisis. And we were thinking, we need to see these kids before they're at that crisis level. Why we don't turn anyone away? Why aren't we seeing them? And figured it was transportation. So we sent after a lot of meetings with the district and the district attorney, we sent two of our therapists into a high school. And a month later, one of the therapists came into my office and said, I just have to tell you, because we didn't know how this was going to work. It was a total pilot. But he said, I just wanted to tell you that this high school boy just told me that the therapist, is the reason he's coming to school.
Wow.
And I'll never forget that moment. I know where we were. I know where I was standing. I know where he was standing, and saying, we have to do as much of this as we possibly can. And it is free to the students' families. Just because of
Free.
our model, we don't know what insurances that particular therapist takes, or if any. So some of the therapists who go into the schools don't take any insurance.
That's right.
So it's just free. And right now we're in 36 schools throughout Ottawa County, and four of those schools are in Kent County.
Wow. And so within the school, but if you're a parent watching this and you didn't know this, they could contact Mosaic and said, hey, I heard you were in 36 schools. Are you in my kid's school? And then you
Mhm.
guys could help arrange
Yes,
some stuff that way, or the school themselves might do it. But 36, I thought it
mhm.
was like in its 36 schools now. And
36. Yeah.
that's
So
amazing.
when
And
a
they're usually
parent
30-minute sessions or something like that.
They're 30-minute sessions. We don't want to hurt the kids academically.
That's right.
However, if a student ever needs more time than that, they can do that right there, and they can see that student for more time. Maybe it's determined that really this wouldn't be appropriate for that particular student. That student needs more, but the family never knew that they would be able to afford it at Mosaic. So we can make that connection. We can help parents or siblings get connected with a Mosaic therapist. So, that because I again thank you for this, because we're always trying to get the word out
Right.
that we are here.
Yeah, and the thing is, the thing that's important to me, that's a CMH distinctive, that's also a Mosaic counseling distinctive, is you're family centered. So if someone's under the age of 18, you're working hard to include the family
Mhm.
in the process.
Right.
Sometimes you can't for specific reasons, but
Mhm.
your panelist, your
Mhm.
school presence has a
Mhm.
family-centered focus. And that's, by little
Mhm.
people don't know this, but for CMH, for kids under age 18, we have to actually do family-centered planning. It's a
Mhm.
policy. And to me, it's an advocacy point. And so I know that you're trying, when you're in school, it's not like, see if I got it right. Okay. It isn't like we're trying to create the counseling center in the school. Okay. And it's just a look-alike and they go to counseling and they go to class. It's more like there's an intervention and a process in the school. But the goal has always been to try to get them to receive services outside the school if able. And you weren't able to
Yes.
reach a lot of families before because they couldn't get there or whatever. Now there's an
Right.
access point.
Right. That is who this program is for. It's
Okay.
for the students that would never be able to access professional counseling if it were not for somebody coming in their school. And I do want to point out as well, there it's just like we moved the therapist office into the school for that time. All the paperwork, parental consent
That's right.
has to happen.
That's right. Yeah, it's all, and the thing is, the service is provided by masters prepared licensed professionals. And
Right.
and it's a unique thing. When you think about it, it's quite innovative. People say we need mental health in the schools, mental health in the schools. I hear that all the time as CMH director. And I'm like, don't we have somebody in 30 something schools?
Hmm.
Right? And so it's not that folks in Ottawa County that think we have an access problem are wrong per se, but I think
Hmm.
that overall mental health and mental wellness is in the limelight and we want to make sure people have access to it. But I know for
Right.
me at CMH, we have access standards. We have people all the time frames. I know that you have that program. So sometimes I'll just be honest, I get a little frustrated
Hmm.
as a CMH director, like, no one's getting mental health. And I'm like, well, we're spending $62 million a year on it. Your
Right.
access. And so really it's the type of care and access when people need it. And I
Yes.
think that's the key. And you guys do
Yes.
that um,
Absolutely.
hands down. So you're in the schools. We got all
In the
ages.
schools,
We're
right.
free. Sliding scale.
Yeah. And
No,
sliding scale, I did say $6, but really it's $6 or volunteer work.
that's
So
right. Yeah, it's right. And Sarah, do you have a waiting list?
no,
You
we
mean you
have
don't have a waiting
never,
list?
we've never ever had a waiting list.
That's right. And
Ever.
and Sarah knows I'm asking that sarcastically
I
because
know.
I'm aware that one of Sarah's missions is, oh no, we're finding somebody and we're going to keep
Mhm.
expanding. You could have kept it real small. Yeah, you didn't found it, but you were a key developer in this thing. Okay, you won't take credit, but I'll give you credit. Okay. And I'm telling you, you could have kept it at the church in the Tri-Cities thing. 50,
Mhm.
50 therapists was like, whoa.
Mhm.
Because of your need and mission to get help now, you
Mhm.
need a robust panel or it doesn't
Right.
work. But you're
Right.
doing what every parent wants done. Like like we get parents coming to us all the time, right? You're doing the same thing where you're helping them navigate a provider network. You just happen to operate under, there are
Mhm.
contract providers, but you operate it. And I keep going back to it. Imagine if we could call our, I don't know, whatever health insurance, I don't want to name them. And they're doing the same thing. Hey, you know what? Let's talk for an hour. Let me find the person. I'll call them for you. I'll make sure I'll see who has access to care. Because what I think the real access to care crisis is actually getting into pretty much insurance company only type clinics. They're doing their best, but
Mhm.
well, we're full. Our clinicians
Mhm.
full. You're like, I better expand. I better expand. You can actually do what CMH can't do, right? Which is to keep expanding to meet the needs. I have to keep expanding the services within the same structure. And
Mhm.
as you know, we have no incentive of CMH to find new clients. We don't get any new dollars for that. We
Mhm.
have to do it. That's our job.
Mm-hmm.
You don't either.
Mm-hmm.
And that's why we're such vital partners, because you're mirroring a lot of the same principles and characteristics of the public system, but you're
Mm-hmm.
available in the true nature. You even got a special grant from the state earmarked in the budget validating your model. They gave you, it wasn't $1 trillion, I wish it was.
Mm-hmm.
They gave you a little money, but it was really recognition that
Mm-hmm.
you're doing something distinct, because CMHs, we get a budget and they have very few organizations get an earmark in the budget to validate their model. And I wasn't going to tell Sarah, I didn't tell Sarah I was going to do this. You should be very proud as an organization. I'm part of another organization called Be Better, or Team Be Better. We got one too for athletes, but you got this and it validated. Now, didn't you just recently expand into Kent County too?
We did. We did that last year. We had a You Matter. It was called You Matter campaign, and it was it took a lot of explaining because it wasn't a capital campaign. It was kind of like a capital campaign, but we
Yeah,
didn't need a building.
right.
As I told you, we only have 10 staff.
That's right.
And so 10 staff in the building that we own, we don't need another one. We just wanted to raise money to expand our services, even within build our capacity in Ottawa, because of having so many therapists. We did need to hire a couple more staff. But then we also did expand into Kent County, just like, as you mentioned, we had been in just the Tri-Cities for
Right.
maybe 38 years, 37 years, and then expanded down the lakeshore to Holland, and
That's right.
then covered all of Ottawa.
That's
And
right.
so, and you're right, we never had to do that. And I always joke, I could have so much better sleep if
Right.
we were just still in the Tri-Cities. I would sleep every night like a baby. But it's the right thing to do
Yeah,
because
and you are,
it's the right thing.
it is, and it's in the spirit. You're kind of like, you're a nonprofit acting like a true nonprofit, and having public system characteristics in terms of
Mhm.
mission and outreach and access to care. Our access department, we work hand in hand with you. We're sending people back and
Mhm.
forth. Hey, we
Right.
got some folks for you, and so you're part of our
Hmm.
network, and you're able to contact us when you're independent clinicians
Right.
saying this might be more than our level of care, and then
Right.
coming back to us, and we're always trying to improve that so that we're an
Mhm.
actual system of care. And what's good about you is that you'll take all levels up until, okay, it's clearly something that requires something
Right.
more than a traditional
Hmm.
outpatient or even intensive outpatient, because you do that too.
Hmm.
And that's the partnership, and that's why it's vital.
Hmm.
And, in a second, I'll see if anybody has any questions for you, but then I'll have you just pop up your website so we have on camera how people can get.
Yeah.
And what's going to happen once people watch this, the phone's going to go off the hook. Because even though you've been there, you have been in every venue I can imagine saying, hello. Some
Try.
people are still going, Mosaic, what's that? Is that like a
I
painting,
know.
or what is the thing? And it is unique to our community. There isn't, and I've done some check-ins there. There
Hmm.
isn't anything like you anywhere else in the country in the exact way that you do it. Not one.
I don't think so either. And you mentioned the state.
Yeah.
I've been to Lansing many times now in the last couple of years,
Mhm.
and no legislator has heard of anything like Mosaic. And I usually start out with, I I bet you've heard that there's a shortage of therapists. Oh yes. Yes, it's awful. People can't get into counseling. Oh yes. Wait lists. And then I just say, but not for us.
That's right.
We have an endless supply of amazing therapists who are in private practice and they want to give back. And
Yeah,
we allow, as you know, a
it's amazing.
system to be able to do that. So you're giving back, but you're not doing pro bono.
Right.
You're not, the therapists aren't getting $6. but it's this lowered rate that they give to us that allows then that that dollar that's say then donated
That's right.
to
And
Mosaic
I
that goes
think the
back
wait,
out.
I think the wait list and the access issue is really if you're like an agency-based outpatient clinic and you have your own therapist on staff, right?
Mhm.
You're managing a network.
Mhm.
If
Right,
you're like just a center, you get to capacity with your four therapists or your
right,
five. And I'm in
right.
contract negotiations right now to expand my network to get more things in it. But what you're doing that's different is managing a network of providers, and there's a vital difference. And so when I talk to legislators, and I'm talking about us and you together, we're managing networks of providers. I do have some directly operated therapy services for folks with the most severe conditions, right?
Mhm.
But other than that, I'm managing a network like you. And so when we're hearing, Sarah, that there's a therapist crisis, well, yeah,
Mhm.
okay. In the old model of set up a
Right.
setting, hire a
Yes.
person, can't get
Yep.
them in, can't
Yep.
pay them. So
Mhm.
you're appealing. I know when I was in private practice, you were appealing to people that, hey, I might not want to work 40 hours a week doing therapy. I might have 10 hours a week and
Mhm.
I could do that. And then with my expertise, you would
Yes.
send me, and you
Mhm.
would send me the folks like we think they might need CMH, and I'd be able to help bridge that gap in the past.
Yes.
And but what you would always do, which you do, okay, is that if somebody was in urgent need, I know personally, you would personally call every
Yes.
single person on the panel until you got some.
Yes.
Michael, I need someone to see him
Yes.
tomorrow.
Yes.
Can you make time tomorrow? And
We do
most
that.
of the time I'm like, you bet. But if I said
And they
no,
do. Right.
and you know, I know other people in your panel. I'm going to give a shout out to Christopher Pease, who's a social worker in Grand
Christopher.
Haven, and he's another one working with the courts, working in the schools, has a private practice.
Mhm.
Mosaic calls up and says, "We got someone that needs the care
Mhm.
tomorrow." Right.
Yeah.
And I do that here at CMH. I also do that with the Team Be Better folks, right? But when they
Mhm.
need the fully licensed professional ongoing care, you're the
Mhm.
folks that we send people if we can't serve them.
Yeah.
And so
Yeah.
it's an amazing network. So I want to open it up real quick. If there's anybody here that would like to ask
Mhm.
Sarah a question, we don't have many participants on the Zoom thing, but you know, I do have some staff and a board member on. Paul, did you want to ask Sarah anything? There he is. And you're
Hi,
still,
Paul.
yeah, he's still muted. So, Mandy, you might have to unmute him. There you go.
I was able to do it. I don't have any specific questions. I am really impressed with what it is that you do provide there for the community, though. This
Mhm.
I have never seen anything like this as well, and I wasn't aware of the services and the umbrella that you like. It's all around in our region, so
Right.
it's really fantastic about the services that you provide. Really creative kind of thinking in this area.
Yeah,
Thank you.
Paul, what they also have, what she hasn't talked about is outcome data.
Yep.
Okay. And
Yep.
Paul Duff, who's on the CMH board, also part of the community mental health system for several decades. Um, and Paul, his whole career is always focused in one way or another on doesn't matter what you do.
Yeah.
And I can tell you, Sarah, for the folks that we send you, our folks, we keep
Mhm.
track. Did they go in the hospital? Did they? They just don't.
Mhm.
Your panel gets them, and very rarely are someone that we're referring to have to be hospitalized within 30 days of sending
Mhm.
them to you, which is the standard.
Mhm.
And so there's a series of success outcomes that I know that,
Mhm.
but a lot of it is changed lives in the narrative stories
Right.
of the people you serve.
Right.
That's been more important to you than, yeah, 27% of our folks, da 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 da. You were like, let me tell
Mm.
you these stories.
Yeah. Can I
Yeah,
tell you a quick story?
yeah, please do.
So this was actually a couple years ago, but it just speaks to our model. I happened to be the one actually talking to a mom with a suicidal 13-year-old and had already called 3 places in Ottawa County for help and had insurance, a very popular insurance.
Mhm.
But all 3 places said, I'm sorry, we don't have anyone here available that takes your insurance. And I mean, as a mother, I mean, this is something that definitely drives me greatly is the
Yeah.
way that I feel, about my children. And what if I couldn't get them help? I mean, it's crushing if I couldn't get them the help they need. And that was happening to this mother, a suicidal 13-year-old. And so I looked at the portal, and at that time, which is another story, we also did not have a therapist available. So I unclicked the insurance and 8 therapists popped up. And so I just said, "Hey mom, listen to me until the end here. But we also don't have anyone available. So we're just not going to use your insurance because there is a suicidal 13-year-old who needs to be seen right now."
Right.
And so we're able to get that child in, the tween in, or really teen, right away.
That's
And
right.
so that's what we focus on at all times, that someone needs help, they need it right now.
Yeah, and we at CMH, we have to do like funding source of last resort, this,
Mhm.
that, or whatever. You unclick the box, say, come on in, we'll figure it out.
Right.
And we do the same thing. We have to figure out
Mhm.
later how we're going to
Mhm.
do the expenditures. And that's
Right.
another distinctive.
Mhm.
But there's a lot of stories
Absolutely.
like that. I mean, there's a lot of
Oh, yeah.
stories like that that I don't think our community is aware of because anytime we do a needs assessment in our community, mental health goes to the top of the list. It's usually transportation, housing, mental health. Well, one, two, three.
Mhm.
Every single Ottawa County needs assessment in the last 2 decades, those three things
Mhm.
pop up somewhere.
Mhm.
And the last one we
Yes.
had mental health. I was all for like, yes, addressing the mental wellness and mental health needs of our citizens in Ottawa County is absolutely essential.
Right.
However,
Mhm.
the people taking the survey weren't even aware of certain resources,
Right.
right?
Right.
And so if you don't know, like, oh, you go to mental health. So really, it's getting the word out.
Yes.
And yes, do we need more providers? Well, of certain types we do, and kind of like clinic-based W-2
Mhm.
employee therapist-based thing. Sure, we need to
Mhm.
track them. It's hard to get them. We have a
Mhm.
hard time hiring people
Mhm.
too because of the compensation levels and things like that.
Mhm.
But you have found a way to develop a network that takes a lot of those variables out because
Mhm.
people are asking you to join. You never have
Mhm.
once. I know for me to say like, hey, Michael, could you join the panel?
Mhm.
I said to you, hey, can I join the panel? And you're like, well, we'll see. Let's go through. Yeah, you're in, right? But
Right.
my point is the panel, the therapists are seeking you because you're like, I would call a gold standard on being a network manager.
Mhm.
And if we can learn a lot, the public system and other systems on how you've done it, because people think Mosaic counseling, they think, oh, they're all counselors for Mosaic. Boy, they have 200 staff.
Yeah,
Well,
right.
you actually it's harder to do what you're doing.
Mhm.
You're developing a network with network standards and access
Mhm.
standards and
Right.
expectations on response time,
Mhm.
like a good man, that's to me good managed care.
Mhm.
You're doing a managed care model. Now, those are my words, not yours, right? And the reality is, if it was replicated in the same way, that they would have to adopt the same philosophical principles you have, but they would need
Mhm.
your 10 staff. I know most of them.
Mhm. Mhm.
They have the same mission and vision.
Right.
Help people now. You get interns coming in and out. You've been a training
Mhm.
program.
Right.
You
Christopher Peace,
That's right.
great
Right.
therapist, right?
Right.
He
Right.
interned here.
That's right. And learned a lot. And see what Sarah doesn't tell you, when she expanded into the Holland area, I was in the office
Mhm,
that we expanded. So I got to use a Mosaic office.
mhm,
And Christopher Pease got to use it, and some other folks on the panel. We had this little group, and we're almost like the Mosaic group in this thing, but we knew we were
mhm.
all distinct clinicians with distinct talents. And we would sit around talking about, not in specificity, in general
Right.
cases, and I'd use my expertise and
Mhm,
they'd use theirs. And there's a lot of
mhm.
that dialogue
Peer
that
support.
happens.
Yeah. Yeah.
Yeah.
It's important. Absolutely.
So can you share your website real quick so that we make
Yes.
sure people know how to reach you? We know here. Okay. Oh yeah, yeah, yeah. So Chelsea wanted to know, say, how are you using the millage dollars we gave you?
Oh, yeah, and thank you, Chelsea, because I did want to say thank you for this partnership. Thank you for um, giving Mosaic millage dollars that we are able to use. We are so appreciative of that. I'm just pulling up our website at the same time as I am going to answer. I'll answer you first. So part of that money actually goes to something that we started 2 years ago, which is a collaboration with the Tri-Cities YMCA.
That's right.
And so we have a therapist that's over there, not currently because they're under construction, but the client, the people that she was seeing, the members that she was seeing are just being seen over here at our office. But
Right.
normally she is there. And then also we are running monthly QPR suicide prevention groups, also, or not groups, but trainings, also with the Tri-Cities YMCA. But then also for clients, for people, is where a lot of that money goes, is for the people who
Sliding
are
scale on the,
uninsured.
yeah.
Yes, for that sliding scale that we are able to make sure that they are seen.
Yeah, and so the millage is going for collaboration with natural environments like the YMCA, which is
Hmm.
great. We gave them millage too. We started that. We were building on what you had already established, and then we
Hmm.
expanded it on the YMCA side for some other stuff,
Yes.
some social and physical ed type stuff. And you're
Right.
using it for filling in the gaps to give
Right.
people that can't afford care
Hmm.
care. And, we get
Right.
quarterly numbers on that, and we'll be publishing those in one of our board meetings pretty soon here. And without the millage, and it's up for renewal again in August. And so without the millage, CMH can't be as vital as a partner to ensure that the gaps are filled for things
Hmm.
that Medicaid doesn't cover. And that's the point. We're not just a Medicaid insurance program. We're
Hmm.
community mental health. And so that millage needs to go to our community partners to do stuff primarily that we
Hmm.
can't do.
Hmm. We are also going to be starting two support groups also
That's
that
right.
will be fully funded by the millage. We're just trying to, we want, things always need to make sense. And so we want to start to that have the greatest need for those issues, and finding the therapist on our panel that will be a great match then also for that particular group.
That's
And that'll be
amazing.
great. I know you and I are both fans of support groups.
We are.
You know,
Yeah. Yeah. And
I think
people
when you
love
walk
them. And
in,
yeah,
yeah,
they like them when they go, right? If you
right.
offer them, they don't go, you're like, okay. But yeah, they're very efficacious and very supportive in terms of outcomes and how people happen, and that works very well.
Mhm. Yes.
So yeah, thanks Chelsea for the reminder on that about millage, because it's a vital millage partner.
Well, we
Yeah.
are, yeah, we're total partners. And there was a time when Mosaic did not receive any millage dollars,
Mhm.
um, and received lots of referrals. And then that's hard on a little nonprofit, you
That's right.
know? And so that's why I'm just so grateful to being able to be part of the millage.
Yeah. Awesome. Okay, show the website.
Okay. All right. Can you see it?
Yes.
All
Yes,
right.
we can. And then obviously the website address is on the top for those, you can watch this later. But it's mosaiccounseling.com. How
It's
convenient.
.com because org was already taken. Org
Yeah,
is used for nonprofits, com
yeah.
is for profit. So I always want to explain that. But I want to take you down to right here. You see, click here to schedule a free intake. So
Wow.
that's where anyone 24 hours, 7 days a week can schedule that intake. Here's our phone number where you can call if you want to talk to someone and they can schedule it for you. Um, the woman who normally answers the phone, her name is Karen. You will hear a warm voice. That's also something that we will never not have somebody, a human being, answer the phone.
That's right. No
Um,
AI
I
for that. Yeah.
I have been I call it a secret shopper client. Sometimes when, especially when we were expanding into Kent County, I needed to know, okay, of the current mental health agencies that would be, similar, not exactly, but similar to what we do. What happens when you call? Are you on a phone tree? Do you get called back? And the more confusing it is, the more you have to do. If you're not treated by a warm, respectful, compassionate voice, it can be really hard. And I remember feeling in some of the phone calls that I made, I'm pretending right now. I'm
Right.
just calling really because I want to know how this is working at this agency. What if I was depressed? And what if loved one had just passed away? What if my spouse just left me? What if my child passed away? I mean, all the different things. I had so much anxiety, I couldn't go to work. All the different things that could be going on. I wouldn't get past that phone call. I wouldn't be getting help. So,
That's right.
all that to say, we'll always have
Yeah.
a human being answering the phone.
Yeah. And Karen's great. I try to call up and she knows my voice so much. She's like, Michael, stop, but I know it's you. But
Yep.
she's there's a real connection. It's not a
Mhm.
welcome to Mosaic Counseling. How can I help you? It isn't that.
No, no,
And so
no. I like to say if someone reaches their hand out to us, we are grabbing it. We won't let it go as long as you don't want us to let it go. But, all the help that you could possibly need, we've got you. This is video that I cannot show you because we tested it before we started and you can't hear it.
right,
But it's maybe a little over 3 minutes long, but it's a great video that just shows what we do, all the different things we do. We also have an employee assistance program.
right,
Um, I think there's a little bit about that in there. But then taking you back up here, so our services, outpatient counseling that we've talked mostly about, we have an employee assistance program. So that means that companies, nonprofits, school districts. So we'll take a school district, for example. We're the EAP for 4 school districts in Ottawa County. So all of their staff have direct immediate access to our therapists. You get so many free sessions, and then we have a seamless segue to either insurance or needing a sliding scale.
right,
So that's a great program. Our school outreach support groups. We do QPR suicide prevention. We've trained over 12,000 people in
right,
QPR. I think that I have personally trained 4,000 of those.
right,
And it's an hour. We always do it for free. And you leave empowered to know what to do. If someone that you love, if someone that you work with, a friend, if they could be suicidal. And then we've also started a listening room series, which are podcasts. They're AI podcasts, but we've put them together. And so that's exciting. Our therapist. Let's just look if it logs in. I'm going to
oh,
take you on can you see the therapist page?
oh yeah, yeah,
Okay. So we're just going to take a quick tour
there you
of
go.
our therapists. And there they are. I'm going to go fast because
Right.
it, there's clearly a
They're,
lot.
they're there. They're not imaginary.
No, they are right
Yeah. And,
there.
and they're not, because this is happening now. They're not AI algorithms. There's a new app out there you
Mm.
know, AI algorithm. And you could actually tell the therapist, like, I want you to be like Carl, Sigmund Freud, they'll do it that way. But you have real people.
Real
Um,
people. Yes.
and so even though it's called Mosaic Counseling, I always refer to Mosaic as the Mosaic Counseling Network because and I know for branding reasons you don't do that, but to me, I view it that way. I mean, just look at the network of providers that are there. You have a board of directors, you have your vision there,
Right, right.
um, and it's really, and I know I keep saying it, it really is a network. It's a
Mhm.
and it has all of the positive features of managed care.
Mhm.
You're not limiting the amount, scope, and duration of services. You may say,
No.
hey, listen, we're going to review stuff. Like you might review stuff after 10 sessions or 5 sessions. How is it going? Like if they're on a sliding
Mhm.
scale. But I'll let the community know when I was on the panel, anytime I asked for a recertification of 5 additional sessions, as long as
Oh,
I answered the questions, because there was a litmus test, it was always approved 100% of the time.
right. Yeah, I always say to the therapist, new therapists when I talk to them, I'll say, so it goes like this. We give you so many sessions, and then you ask for more if you
Right.
need them, and then we say, okay. That's
Now,
that's how it is.
yeah, I know, but you do
Because
ask some questions. Yeah, but it really is it. See, managed care companies, their role and function is to ensure that benefits are spread equally among. So sometimes they limit care, right?
Mhm.
You have enough controls though, where you're not just like, go, all right. I mean, you ask them. The therapists have to not even disclose personal information about the client. That's what's
Oh
brilliant.
no, no.
Or even like you're not saying like an insurance company, I need to review the treatment plan and see
Mhm.
if we'll authorize 5 more.
Right.
You ask some key questions where the therapist, and this is key for people to understand, where the therapist remains the controller of the
Yes.
amount, scope, and duration of the service based on
Mhm.
what's needed.
Right.
And then
Right.
Sarah, now every now and then you got one. Okay, listen, we've had 32 sessions. Have we figured it out yet? Right. But it's the good parts of managing a network.
Mhm.
And that's the thing that you've been able to do. And that's why you're a vital partner, not just for CMH, but for our region. Now,
Mhm.
I'd love to replicate you throughout the country. The problem is there isn't 100 Sarahs. Some of this isn't turnkey.
Right.
Some of this is unique to
Mhm.
Mosaic. Because we've talked
Mhm.
about this years ago. Like, hey, what if we, spread? Well, you have to spread the uniqueness of you, which is hard. You can't. It's not like
Mhm.
a franchise.
Right. Yeah.
Some of the principles could be replicated, and some organizations watching this will be like, "Well, I do that. Well, I do that. Well, I do that."
Mhm.
And I'd say, "Awesome, great,
Mhm. Mhm.
awesome." But you're managing a network of care. You're in schools. EAP. I
Mhm.
forgot about that. Right? You
Mhm.
even sent me on an EAP thing once to one of the hospitals
Yes,
when I
right,
was.
for crisis care, I
That's
think.
right. And
Yeah.
and so the lived experience I have, but the community needs to understand that the reason why Mosaic and our other partners are so important that even when we're expanding our stuff, we have that CCBHC funding, right?
Mhm.
And we CMHs can expand. Well, we've chosen to only expand where our partners can't be.
Mhm.
So we're not using our CCBHC kind of philosophy to replace a Mosaic.
Mhm. Right.
Some CCBHs in the state don't have that same rule. They're same view. They're competing
Mhm.
against providers, and we don't do that here. We
Mhm.
what do we need? In
Mhm.
addition to our network, and we're blessed to have a Mosaic and our other partners that do this work.
Mhm. Right, because you
So,
don't want to
good.
duplicate,
No,
so you can put those resources to something else.
yeah, and the thing is like, did you know, right? The name of the series. Did you know that Ottawa County actually is blessed to have more access to care than most counties do?
Mhm.
And we're blessed. And
Mhm.
so
Yes.
we need to celebrate that here. Not to say that, okay, everything's fine, everybody can get what they need. I think
Right.
what needs reformed is how care is delivered.
Mm-hmm.
And you've done it with the network, we do it with the network. The
Mm-hmm.
model, there are some providers in our community that you have to get referred from a
Mm-hmm.
physician
Yeah.
to get into their behavioral health division.
Mm-hmm.
Well, what if you're a person that doesn't even think if you know you need counseling?
Right. Or
Like
you
what
never
if
go
you
to a
were like that
physician.
person? Yeah, like how, I'm going to go to my doctor or they're going to
Mm-hmm.
refer me. And
Right.
I'm not critiquing that model saying it's a bad model. It's just more of a medical
Right.
model, right? It's more of a
Yeah.
medical
Mm-hmm.
specialty. You go somewhere and they go, oh, we're going to refer you to this clinic because
Mm-hmm.
you reported you had anxiety symptoms on the GAD-7 scale. And so we're
Mm-hmm.
going to refer you to this clinic. And the clinic says, gee, we can't get you in because we're full, because we have six
Right.
people on staff.
Right.
And then there's no one managing at that point. There's no one that stands in the gap besides
Mm-hmm.
us and you and some other partners in this community to say,
Mm-hmm.
oh, if not, they're here. Like you're like, if I don't have if this panelist doesn't work,
Mm-hmm.
and clients feel comfortable calling you up and say, you know, the match you made, not so hot. Like you've had to
Oh yeah.
make that call.
Right.
I know that difficult call to the
Mm-hmm.
therapist. Johnny's not going to be seeing you anymore,
Yeah. Yeah.
right? And that
And
can bruise our ego.
from being a therapist
Yeah,
and when I was, you kind of feel it too.
right,
You know, it's usually not a surprise to a therapist that there just didn't seem to be a rapport, and you know that it could happen.
right.
So,
Now, one of the areas that Ottawa County needs to establish additional partners is in the area um, of providing counseling and psychoeducation services with folks with intellectual and developmental disabilities that are able to participate in that type of care. Sarah, there is a challenge of
mhm,
finding providers that are comfortable of working
mhm,
with guardians and those folks. And therapy looks a lot different with that group. And so,
mhm,
it's not an area that you've had extensive growth, but I'm planting it in your ear because you've risen to the challenge to develop a network to address multiple needs. And I think in
mhm,
the future, we need some of that stuff for some folks that are in between our mental health division and our IDD division and could
mhm,
benefit for some modulated forms of traditional talk therapy in a
mhm,
certain way or groups done in a certain way. And we're trying to do that here. But to
mhm,
me, that's a challenge
mhm,
that I'll, in coming years, we'll have to look at together how we can deal with that. But just people knowing where you are now, the extent that you're available, that you have openings, and if you don't, you find a way to
mhm,
kind of hold people, like we have our navigators kind of holding on to people until a match is found. We do that
mhm.
over Team Be Better too, same idea, CMH Team Better, Mosaic, same models. We
Mhm.
don't walk away from people. Our navigation isn't
Never.
putting someone in a boat and pushing them out and go, navigate that way. You're in the boat with them until they
Yes.
arrive on the next shore.
Right. Right.
And that's the support model that we're
Mhm.
needing that needs to be replicated,
Mhm.
and so any last things you'd like to let us know about Mosaic or maybe any
Mhm.
upcoming events? I don't know. Just anything you'd like to share?
We had an event last night and it was amazing. So,
That's good.
uh, I I would like people to know that we are here. We are available. While our main office is in Grand Haven, the therapists use their own offices. So they're everywhere.
That's right.
They're all over Ottawa County, Kent County, and we have some in Muskegon County as well. Virtual, in person, either one. But then also for everyone who has someone in their life too that they think might benefit from professional counseling, we are the easiest referral to make
Right.
because you don't know. My neighbor has just told me how much they need to talk to someone and they've been looking for somebody, all I have to do is say, call Mosaic Counseling or go to their website. And I don't need to know what kind of insurance she has, or if she has a high deductible, or if she has no insurance. I don't need to know any of those things. It's
Right.
just call Mosaic. So
Yeah.
it's just so easy. And we're here. And I
Yeah.
appreciate you very much, Michael and CMH,
Thank
so
you.
much for being included in the millage.
Yeah. And we're vital partners. It's only going to get stronger, my friend.
Mhm.
And and in final kind of comments, I'll say, the thing is, we're talking about evidence-based, professionally provided services. We're
Right,
talking about services like Mayo Clinic would do or somebody would do. We're not talking about services that are outside the orthodoxy of evidence-based,
right.
professionally
Mhm.
provided stuff.
Yes,
And there are other things that can help people, adjuncts
absolutely.
and life
Mhm.
coaching and all that stuff. But I want to be
Right.
clear that
Mhm.
the distinctive here is this is part of since I've been back at CMH, it's about keep the community and community mental health, one aspect of it, millage,
Mhm.
this stuff, and center of excellence.
Mhm.
And Mosaic is running center of excellence
Mhm.
stuff. A lot of their panelists are trained in evidence-based practices
Oh, yes.
and they utilize stuff,
Yes.
DBT
Yes.
and EMDR and all these things. But
Right.
the range that they're offered are within the orthodoxy
Mhm.
of professional
Yes.
evidence-based care.
Right. That is
And
part of
that's a
our
distinctive,
mission statement. Yes.
right?
We have non-negotiables, like an organization should have. You have your non-negotiables, not drifting from your mission. And
Right.
it has always been professional counseling.
Yes.
Yes.
And you guys have the golden thread, assessment, treatment planning, monitoring of the treatment progress, discharge planning, but people are always welcome back. Discharge planning
Always.
might be an end state for a particular course of therapy, but it's not
Hmm.
a discharge from the connection.
Right.
And
Oh,
that's a
no.
distinctive we have with you. There's
Hmm.
never you're totally done. You can come back.
Yeah.
See, my
Right.
view on mental illness, if you really have a mental illness, it goes into
Hmm.
remission,
Hmm.
maybe for long periods of time, but it's
Hmm.
never cured. So when
No.
people talk like, oh, I've been cured of major depressive disorder, I'll say, well, yeah, okay, right now you're in remission. And they go, why are you saying that? Well, it's the same thing as leukemia. You
Hmm.
you might be in remission from
Hmm.
cancer or
Hmm.
from a heart situation. And
Right.
mental illness, there's no difference. To me, if you have mental illness,
Hmm.
mental health
Hmm.
symptoms is totally different, or dealing with a life
Hmm.
situation can be
Right.
resolved. But if someone has a mental illness, it is a
Hmm.
life course
Hmm.
issue that hopefully have long periods of remission, but you have to re-engage in care throughout the
Yes.
lifespan.
Right.
And that's
Right.
Mosaic does that. It doesn't matter where
No.
you're at.
No. And I would just like to then also say,
Yeah,
if you think that for the people who are watching this, now and later, as you say, it's going to be available, if you've been thinking about counseling, but it is intimidating, if it scares you, if you don't think what you're going through is up to the point where you should be reaching out, or if you don't think you can be helped, you know,
that's right.
you don't have to live like that. You don't have to live, with that pain or with what you're going through.
That's right.
And friends and family are friends and family, and friends and family are not therapists. And so just
And
try it.
you know, I know we can go for another hour, right? But listen, that's so important
Hmm.
because some other perspectives are let's train all of the family members and all of their peers to provide
Hmm.
the interventions. And I'm
Hmm.
like, no, we can train them how to be supportive to that person and get them to the right care, but
Hmm.
not replace care.
Oh, no. Well,
You
in our
know,
profession, that would be an ethical violation because you'd have a conflict of interest, right? I
Right,
mean,
but even like the suicide prevention training you do, you're not saying
Mhm.
now you're a certified suicide
No.
expert. It's identifying
Mhm.
and assisting, right?
Yes,
And
referring.
but you and I both know there are models that try
Mhm.
to suggest like, well, I can teach your friend how to
Mhm.
be there for you. And especially like a
Mhm.
teenager, right? Then they end up carrying the weight
Mhm.
of that stuff. Like my friend is telling
Oh,
me
right.
this, that, or whatever. And if we're not careful, we're not trying to
Mhm.
create little social workers or therapists everywhere with
Right.
education. But it's
Then you're a friend.
right. Be the friend that can
Be the
have
friend.
boundaries and know where to
Mhm.
go for care.
Right. When I was in private practice, I would have people contact me and different kind of, maybe closer, maybe kind of peripheral people that I just knew and said, I know you're a therapist. Can I come in and talk to you? And I would always say, no, I'll meet you for coffee as
That's
a
right.
friend. I'll meet you for coffee and we can chat. I am your friend. And if need be, then I will make a referral because, and the thing is, and that's very wearing on your
Right.
friends and family too, if you
Yeah.
use them for that, because of that, that's a different relationship.
Yeah, and I guess what I'm saying is that, there are many community approaches to quote, deal with mental health symptoms and mental illness, and they're all valid. But I
Mhm.
want people to hear loud and clear that Mosaic Counseling, I call it Counseling Network, but counseling, it's professionally evidence-based, practice
Yes.
focused
Yes.
care. It's
Yes.
when we know you need care. Now, they'll help you
Right.
figure out if you need that type of care,
Mhm.
right? So it's not like
Mhm.
supportive counseling just going on over there. Like we're just
Right.
being support for trying to give them something to do, which are all important things, but this is
Mhm.
this
Yes,
is professional based
it
care
is.
with
Yes.
flexibility of appointment times. Okay, I mean, your panel does a great job. Oh, you can't meet on Tuesday. How about Wednesday? Right? There isn't every other week, once a month
Mhm.
nonsense going on your panel. I know
Right.
that for
And
a
and
fact. I've
that's
spot checked.
right. And that's something that's determined during the intake too.
That's right.
A new
Frequency.
client might say, the only time, because of my work, and this is stressful, the only time that I can see a therapist is on Saturday mornings.
That's right.
Okay, so we know that now. So now we're finding a therapist who can see them on
Yes.
Saturday mornings.
All right. Well, I don't think there are any other questions, but I know that this will get a response. And I would just encourage folks to understand that Mosaic Counseling is a vital partner in our community and with CMH. Without this partnership, CMH would have to expand in areas that it can't. And that's why we're part of a good network.
Mhm.
And that's why highlighting this is important. Not only have I known Sarah for a long time, I have the utmost respect for the organization. I've seen it in action. Um, Complaints are handled.
Oh, yeah. Mhm.
Sarah, there, yeah, I know. So there is a robust system in dealing with, and more importantly, monitoring how it's going that
Mhm.
is unique.
Mhm.
And I thank you for being with us today, Sarah.
Thank
Tell the staff
you.
at CMH and our community says thank you, and we're glad to partner. And I'll be keeping up the community with our next Vital Partners conversation. And then I plan on having another Did You Know about the update related to the state's plan to privatize the system.
Great.
And if that happens, then there better be 17,000 mosaics.
Right.
So, because with, right. But I'll be doing an update on that. And of course, folks can always tune in to the Community Mental Health Board meetings. And those are posted on our website. And of course, the committees, we have two committees of the board, finance, and then we have one on performance and quality that we've created. So it's a deeper dive into those issues. And I encourage people to check those out. You can also come in person. One of the distinctives of us is that we're public. and we're open. We work for you. And Mosaic is our partner to help have access to care that is far more available than people seem to know. So
Right.
yeah, now what's going to happen now is all 270 therapists are going to get bombarded and we'll have to expand. That's all.
Well, that's what we do.
All right. Well, thank you,
Thank
everybody. I
you. I
appreciate it.
appreciate it.
Yeah. Bye.
Bye-bye.